and we have seen more than 1 million cases. Omicron variant has become the mainstream variant, and China has a rising pressure of the imported viruses. Many places in China have reported the concentrated outbreak of the virus, so the prevention and control of the pandemic is still complicated. The Joint Prevention and Control Mechanism has dispatched working teams to the provinces to guide the preparation work in order to minimize the impact of the virus with the little cost and best efficiency. We will be committed to the version 9 guideline and the dynamic zero COVID policy. We will never drop our vigilance so as to have early discovery, quick treatment, and improve the efficiency of the work in the whole chain. We would target at precise prevention and maximize the benefits to the public. Today's presser is about scientific prevention and control of the COVID-19. We have invited some experts from the National Health Commission, Level 1 Inspector He Qinghua from the CDC, Chief Expert Dong Xiaoping from CDC, Researcher Wang Liping. They will take the questions from the media. Now the floor is open to the media groups. Please identify yourself before raising the question. Thank you. From China Daily. According to version 9 guideline, it focuses on the division of the different areas and the management of the isolated people. So there are some readjustments. What are the reference for such readjustment? Mr. He Qinghua. Thank you for the question. According to version 9, first of all, we have optimized the isolation period and methods of the risky population. And secondly, for the contained, controlled, intermediate risk and high risk level regions, we have set up some criteria and the management measures. Thirdly, we have readjusted the frequency of nucleic acid test of the risky population and the regional nucleic acid testing strategies. Such adaptation is based on three considerations. First of all, the conditions of the pandemic. The COVID-19 is still prevalent worldwide, especially since early 2022. In China, we have found higher possibilities and frequencies of the pandemic outbreak covering wider areas. So the pressure of curbing the imported cases and the rebound domestically is still very high, and it's a complicated situation. Secondly, based on the features of the variant, Omicron variant has become the dominant and most prevalent virus. It has short incubation period and high transmissibility. It can be transmitted very fast, and it's highly insidious. That is challenging for our prevention work. Thirdly, based on our pilot projects, achievements, and our practices in the first line, the Joint Prevention and Control Mechanism in April and May has dispatched teams to Ningbo, Xiamen, Dalian, Qingdao, Guangzhou, and Chengdu, covering 7 cities to conduct full-week-long pilot projects. We have drawn on the local practices of fighting against this pandemic. That's why we did such readjustments. Thank you. Next question. From CMG. Based on BA.4, there are different arguments about it, about its seriousness. So are the available measures enough to defend against such a variant? Mr. Dong Xiaoping, thank you for the question. That's a question of key concern to many people. And let's put it this way. First of all, about the transmissibility. BA.4 and .5 compared to the other variants of Omicron, exhibit higher transmissibility. And there are several factors behind it. First of all, internationally speaking, there are some researches about the partial influence of the variants. The R0 value compared to the other variants of Omicron is higher. And secondly, in many countries, BA.4 and .5 have become the dominant variant of infection. In the past 5 to 6 weeks in North America and Europe, there was a rising number of infection. And for BA.4 and .5, speaking of the pathogenicity, it's quite similar to the other variants. But it could be transmitted very quickly among the elderly people with a lot of severe cases. As to the hospitalization ratio, ICU occupation ratio, they're all jumping up. According to our researches, BA.4 and BA.5, the infectious ratio and fatality ratio will be rising further recently in the near future. So with higher transmissibility, BA.5 and BA.4 are still belonging to Omicron variants. There is no further proof about any non-drug intervention measures to be effective. To be ineffective, that is to say, the current prevention and control measures are still sufficient to defend against BA.4 and 5. Next question. From CMG, Social and Legal Affairs. According to version 9, for the classification of different risk areas, there are some changes. So what are the measures readapted in the different risky areas? And are those measures sufficient to defend against a further spillover of the virus? Madam Wang, thank you for the question. For the infected places, there must be 3 levels of risks. Such a classification is conducive to the other places so as to screen against such risky population. But at the same time, there is a division of contained, controlled, and managed areas so as to cut off the transmission locally. To further optimize our containment measures and solve the problems exposed, in version 9, the criteria has been reset, and we have unified the risk levels of high, intermediate, and low-risk areas. For the 3 risk areas, they refer to the infected county, district, and municipality. For the counties, districts with no positive case at all, there is no need of such a risk area classification. For the people coming from highly risky areas, the receiving areas must introduce a policy of a 7-day medical observation. As to intermediate risky areas, people coming from there must have a 7-day stay-at-home observation when they come to other places. As to the low-risky areas, people from there can be exempted from isolation or observation. They only need to complete 2 rounds of nucleic acid tests within 3 days of coming. And as to those methods, we adopt those methods to cut off the transmission across regions. Thank you. Next question. Thank you. From the Xinhua News Agency. In the recent 1 week, the daily newly added cases amount to over 100, and in key areas, we could see sporadic outbreak of the cases. So, how to respond to the status quo, especially for the most vulnerable places? How to have scientific containment in those key areas? Mr. He Qinghua will take this question. Since early July, nationwide, the pandemic has been breaking out, showcasing a fluctuation of the cases. And in the key areas, we have seen sporadic outbreak with a rising number of daily cases. In the recent 1 week, 24 provinces and 82 cities have been impacted. 6 provinces reported over 100 positive cases. Lanzhou, Beihai, Zhumadian have seen higher risk of transmission in the society-wide. In general, within a very short time, localities could be capable of controlling it. So the virus can exert only limited impact, and localities have boosted their efficiency and effectiveness of containment measures. But with the rebound of the positive cases and with a higher population flow, there is a higher risk of further transmission. So the whole country is facing complicated situation, and all localities must observe the version 9 guideline and be committed to scientific, precise containment measures so as to curb the further transmission from outside. And we must improve our sensitivity to the virus on a regular basis. Once one case is discovered, we must take a tough stance and take quick actions to curb it so that within the shortest time, we could control the infection. And we must stand against a scaled-up infection. Next question. Thank you. From the cover. For the variants, what is the trend in the long run? Will the virus be mutated all the way? Why is Omicron producing so many variants? Mr. Dong, thank you for the professional question. First of all, speaking of the variability, particularly the RNA variability, it's only natural. For viruses, the virus must go beyond the host. And speaking of COVID-19, the host refers to people. The people may be infected, and they can choose to be vaccinated to build a firewall. But anyway, the virus could be replicated among the hosts. Once the hosts have built up their firewall, then the virus cannot be further bred and multiplied, so they have to think other ways. They have to be mutated, especially for RNA. Many viruses have a cyclical period. And as to the viruses of COVID-19, I have to say that the viruses are very smart and hard to handle. Within 2.5 years, there have been multiple variants that could be transmitted very quickly. As to the variation of COVID-19, the majority of scholars believe that such a variation will coexist with us forever, and Omicron variant might not be the last one variation of the COVID-19 viruses. So our monitoring of the viruses and our controllability of the viruses must be the long-standing focus of human beings. Thank you. From China News Service, according to Rationale, the period of isolation and the methods of isolation have been revised. So what is the reference? Madam Wang, thank you for the question. To further elevate the scientific elements and precision of those containment measures, in 2021, Joint Prevention and Control Mechanism selected 7 port cities to conduct the pilot projects about optimizing the containment measures. The center of this research is to observe and testify the risky population and the people working on the highly risky posts. There are 4 categories of people covered in this project. We analyzed their situation of being positive cases, and we discovered that the probation period of Omicron is 2 to 4 days. Most of the positive cases could be detected within 7 days' time. So the isolation period and methods were changed from 14 days of centralized isolation plus 7 days of stay-at-home observation to 7 days of isolation and 3 days of stay-at-home observation. As to the management of the close contacts, it was changed from 7 days of centralized isolation to 7 days of stay-at-home observation. Such a change is based on the features of Omicron variant, and we have optimized our containment measures. It also reflects the principle of precise containment. It will not add up the risk of virus transmission. Thank you. Next question. From CMG. The Chinese government is developing vaccines to respond to BA.4 and .5. Is the available vaccination still effective against BA.4 and .5? Mr. Dong Xiaoping. Thank you for the questions. The R&D of COVID-19 vaccines has been promoted actively in China, not just targeting at the Omicron variants. We also targeted Alpha, Delta variants. We have planned out certain R&D already in those days with scientific documentation in place. Now with Omicron in the picture, several research teams have engaged with certain R&D and generated some results. But honestly speaking, the vaccines are usually administered to the healthy people. We have phase 3 clinical studies, so it takes time. And more importantly, should we replace the existing vaccines and doses in response to the new evolutionary variants of Omicron? We need further studies and a myriad of real-world studies internationally and domestically further prove that the already approved vaccines internationally, no matter what kind it is, we're targeting at BA.1 and .2 of Omicron virus. For example, the pneumonia patients, the severe symptoms, and death cases. And these vaccines proved to be effective. And the boosters were proved to be more protective. According to the international in vitro studies, the viruses have been better controlled in the in vitro studies, but in the real-world data, was it well controlled? We still need data to prove it. As to Omicron variants, referring to BA.1 and .2, the in vitro studies in the beginning also discovered that the activity has been reduced. But as to the application in the real world, we sense that the vaccines are still very protective, especially targeting at the death cases or the severe symptoms. So, experts tend to believe that for the elderly people, people suffering from underlying diseases, the current vaccines, especially the boosters, are still the most efficient containment measure. Thank you. Next question. From CMG, the Voice of China. Version 9 has optimized some containment measures, and according to such adjustments, many people argue that it's kind of a release of containment. What's your take on that? Why is the adjustment of version 9 not a relief of measures, but rather an optimization? Mr. He Qinghua. Thank you for the question. The version 9 guideline is an optimization of the containment measures. We are not dropping our vigilance. For example, version 9 has fully considered the shortened period of incubation of the virus. So, the isolation period of the risky population has been changed, while safeguarding the people's health. We want to minimize the impact over people's life and production. And the nucleic acid tests of the risky population have been raised in number so as to have early discovery. So, the key of version 9 is that we have our priority clarified. And secondly, all the necessary measures are put to place. And third, those that should be cancelled are rooted out. So we are still vigilant, and we are still committed to the dynamic zero COVID policy. In the meantime, we improve the scientific factor, the precision and high efficiency of the containment. We fully combine pandemic prevention and control, and economic and social development so as to maximize the benefits to people's health and minimize the impact of the pandemic over economic and social development. Thank you. From Daily News. In version 9, there is one article identifying the different nucleic acid test strategies under different scenarios. What is the core of the strategy and what's its role? Madam Wang Liping. Thank you for the questions. In version 9, we clarified that with the outbreak of the pandemic in the localities, what is the strategy of nucleic acid test and what's the test of frequency and strategy on a regular basis? And such a risk evaluation must be based on the following. For example, very clear infectious chain, no community-wide transmission. Then we don't need to have all mass tests. And we prioritize on the risky areas and risky population for such a screening. With epidemiology survey and a traveling history identification, if we have a blurred idea, and if the positive case has a lot of close contacts covering a wide range of risky population, then we need to kick off the all-mass screening. According to version 9, we have details about the capital cities and cities with over 10 million population, the general cities and rural areas with different scale of mass screening, their strategies and startup and termination of the screening. The strategy is based on the epidemiology survey and the risk level judgment. we hope to minimize the impact of the pandemic over people's life and the economic and social development. We hope to maximize the benefits to the general public in terms of their life and health. Thank you. Next question. From the Phoenix TV. In version 9, the definition of low-risk area has been changed. So in this new version, what is this low-risk area referring to? The places not affected by the virus, do they belong to the low-risk areas? Madam Wang, again. Thank you for the questions. According to version 9, low-risk areas refer to the counties, cities, and districts that are different from the intermediate and higher risk areas. Compared to the latter two, they certainly have lower risks, but compared to the districts and counties with no case at all, they are still risky. So with no case at all, there will be a regular containment measure in place. But for the people living in the low-risk areas, they are able to leave this region. That's different from the people living in the intermediate risk areas and high-risk areas, as long as they have 48 hours of negative test results. But alert to you, if you have trans-regional mobility coming from the low-risk areas and arrive at the destination, you must report actively and coordinate with the local authority. You must complete 2 tests within 3 days upon arrival in the destination, and you must conduct self-observation so as to be responsible for yourself and others. Thank you. Next question. Thank you. Targeting at the insidious and high transmissibility features of Omicron, what are the targeted measures to have early discovery? From China Review News, Mr. Dong Xiaoping. Thank you for the questions. As we know, as to our treatment of COVID-19 viruses, the first thing we need to do is early discovery. In the new version of Guideline, you may have noticed that we take a diversified network of measures. We have a monitoring system, and we combine the different monitoring systems from different authorities, and we monitor the objects, people, and environment. So in 9 version, there are 8 different monitoring ways. For example, the medical institutions, monitoring of the patients, monitoring of the key places, the key institutions, the risky population, the communities, the medical institutions, the monitoring of the environment, drugs, imported items, and the others. So for the 8 categories of monitoring, their proposal and implementation are based on the actual work we have carried out since 2020. We wrap up those experience based on the past 2.5 years, so they are highly practical. Such multiple channels of observation and monitoring sometimes target at the places with no case at all. For example, the regular daily monitoring, like our monitoring of the medics, imported items, environment, drugs, and risky population. And some monitoring categories are targeting at the prioritized areas and population with the positive cases discovered, so that such a virus might be controlled within the limited area. For example, prioritized places, risky population, isolation facilities, medical institutions. Meanwhile, we also pay attention to the sourcing of the new variants. For example, the gene mutation monitoring belongs to that category. For the risky posts, we have more detailed definition. We also reinforce our monitoring of medication. We highlight such a joint prevention and control mechanism across localities in terms of risk evaluation and early warning system. As to the screening, we have multiple technologies. In addition to nucleic acid test, we have antigen test as a supplement. All in all, the adoption of such multiple technologies and strategies will help to improve China's capacity of responding to Omicron variants. Thank you. Next question. From Southern Urban Daily, since it was published on June the 28th, there have been some outbreak in certain localities. So how can we prove the effectiveness of this new version to the new cases? And what about the implementation of such readjustment measures in different localities? Madam Wang Liping, thank you for the questions. The new version of Guideline is committed to the general principle of curbing imported cases and a domestic rebound. So this new version of containment measures has highlighted the quality of local work of containment. Right now, different localities are adhering to the requirements in their daily containment measures so as to have quick response. So across the localities, they basically are capable of controlling the infection within a short time, as Mr. He has mentioned. Also, we have been summarizing the new problems occurring in the localities and some premium experience. For example, how to more quickly and effectively carry out the cross-regional monitoring of the trans-regional population. And based on the epidemiology survey and the risk evaluation result, our identification of the risk areas must be more accurate and precise. And we also consider how to have more stringent management of the risky population in terms of their isolation strategy and period. All of those problems require our constant summary. We must keep listening to the good ideas from the localities to improve the scientific basis of such a guideline. We will do our utmost to minimize the impact of this pandemic over people's life and social and economic development. Thank you. The last two questions are allowed. From Guangming Daily. What is the progress of COVID-19 vaccination, especially for the elderly people above 60 years old? He Qinghua will take the question. Thank you for your attention to the vaccination. Until July the 20th, the cumulative reported vaccination nationwide amounted to 3.4156 billion doses. The vaccinated population amount to 1.29816 billion. And for the people completing all doses, the number stands at 1.26 billion. And they took up 92.08% and 89.68% of the total. 700 million population have not completed all the dosages. For the sequential vaccination, 43 million people have completed the vaccination. As to the elderly people above 60 years old, the number was above 200 million. And for the elderly people completing all the doses, the number was 223 million, accounting for 89.45% and 84.5% of the total elderly population. 140 million elderly population have completed the boosters vaccination. We will continue to cement the vaccination work, especially among the elderly people. Last question. From the paper, with BA.4 and 0.5 in case, how can the public protect themselves? Mr. Dong Xiaoping will take this last question. Thank you for this question. Speaking of BA.4 and 0.5, they have exerted their influence over the public. For the one thing, we must be reminded about the higher transmissibility and the explosive outbreak of infection, leading to higher likelihood of severe symptoms. We must timely and efficiently discover and control the viruses. For another, we might not as well be panicked by the variants. They are, after all, Omicron. So the pathogenicity has not been changed significantly, and the available vaccines are still protective against the severe symptoms. So we must be aware of the variants, but we cannot go to the extremes. As to protective measures, as is known to all, there are two highlights to be mentioned. First, we must continue the vaccination work, especially among the elderly people, people suffering from underlying diseases. We must minimize the number of severe cases. And for another, the general public must continue the daily protective measures to protect themselves. Thank you. In today's presser, our experts introduced the recent updates of the containment measures, especially about the updated version 9 guideline, and focused on the protection against the BA.4 and 0.5. So thank you for your time, and there will be more pressers yet to come. Please stay tuned with us. This is the end of today's presser. Thank you for watching.